Greetings. This is Dr. Arun KN, nephrologist at Bhagwan Mahavir Jain Hospital, Bangalore. This is an opportunity to share with you a few thoughts of living with reduced kidney function. The incidence of chronic kidney disease has been increasing. And when we say chronic kidney disease, it need not necessarily mean a change only in the blood test, but also means a change in the ultrasound reports or a urine examination report or changes that can be present otherwise picked up by your physician. Sadly, many a time the renal dysfunction is detected quite late, and the only option available at that time would be dialysis or transplantation. However, if you are proactive enough, do test properly and pick up kidney disease early on, especially when you have diseases like hypertension, diabetes, hyperlipidemia, obesity, or any other medical problem, you can have a good life before the kidney function reaches such a low state that you need dialysis. This phase of chronic kidney disease goes through almost 5 stages, and depending on the primary disease, can take from a few years to a few decades to progress. And it need not necessarily be that if you have chronic kidney disease, you have to go on to dialysis. So sadly, if you have been diagnosed to have chronic kidney disease, is it the end of the road? No, definitely not, because it is in your hands to have a good life even with chronic kidney disease. So if your kidney function has started coming down, you can prolong your own kidneys functioning by taking a few simple steps. One, control the primary disease which caused the problem. It can be diabetes, it can be hypertension. Next would be following the various instructions given by your treating team, including being very disciplined about your diet, being very disciplined about your medicine. Diet perhaps is the most important part of treatment of any disease. For that matter, in many Indian languages, the saying goes that if you know how to eat, then you know how to treat your disease. So if you have to involve a dietitian and follow the instructions carefully, you may think these are all small things, but those are the things which are going to help you in the long term. Please, for no reason, discuss your disease with somebody else and try to follow what they say. It has to be your doctor or your dietitian who should guide you, and not what the newspaper or the television tells you. So your diet is tailored to your disease and your condition, and it has to be followed as per the prescription and not what is told to everybody with kidney disease. And of course, there are enough advices around to keep you healthy with various drugs and all that which are available off the counter. Please never ever do that. Medicines are good only when used when they are needed. Using it unnecessarily puts a load on the kidney and hence have to be avoided. So any medicine, it may be as harmless you feel as a B complex, can sometimes put a load on the kidney and worsen the functioning of the kidney, making you lose a few months of your life without dialysis. So be careful in choosing any drug, and never ever take a drug without talking to your primary treating team. So being in close contact with your doctor, being careful in what you are doing will go a long way in keeping your kidneys functioning. So discipline in terms of food, discipline in terms of activity, discipline in terms of controlling sugar, controlling blood pressure will go a long way in giving you a longer life without dialysis, even when you have been diagnosed with a renal dysfunction. Wishing you a better life even when you have a renal dysfunction. Thank you.